As a result of the presence of the Lord's Resistance Army, the Ugandan rebels in the region, and a number of the military interventions to address the problem of insecurity in the region, you have quite a number of different armed actors there, and a significant amount of insecurity and violence facing the people, the civilian population, has decided to flee and to try to seek security in the towns and safety in numbers, essentially. And as a result of the displacement, you have a general decline in the living situation or the living conditions of people, because the displaced people come to these towns and share everything with the local population. And so essentially
there are no camps of other international humanitarian organizations?
There are humanitarian organizations that are present, but they're normally based in larger towns of Dungu or outside the region in Ituri and Bunia, which means that essentially up until recently, because of problems of security and difficult roads and difficult access to the region, a lot of the humanitarian actors remain based in Dungu or Bunia and make only visits of 2 to 3 days to the region, so that we find ourselves, in fact, the only NGO present on the ground with international presence permanently, overnight. Yeah. There are some areas which are secure enough to go by road, but the majority of travel that we do is unfortunately by plane. The roads are really difficult, so the one trajectory that we do by road, it's 8 hours. It's quite a difficult trip. As for the rest of it, it's that the insecurity and the level of infrastructure doesn't really allow us to move around very easily. And unfortunately, that has limited our ability to work in the region, because a normal MSF project, projects, would be work in a town, aid to a specific large structure like a hospital, and then also going outside and trying to reach out to communities affected by violence. And in this case, we've only been able to do that in a smaller periphery. As regards access of humanitarians to the region, I do believe that security is manageable, even if it's difficult. In fact, in these places, the population has welcomed us quite strongly, and MSF works quite a bit with having proximity to the population, and I think that's the strongest point for security, is in fact that the population shares very much with you their situation, and it's really by having that closeness that we can continue to operate and be secure. In fact, we work together with the Ministry of Health, but in fact with the amount of stress that's on the region, it's very difficult for them to cope with the situation, not just the local population, but they've always had relatively limited resources in this region. French people told me it's a désert sanitaire. It's essentially a wasteland as far as health structures are concerned. And there are some development organizations that are in place, but what has happened is that they have, in the past, they have acted on a development model, meaning that they were providing a certain amount of medications and a certain amount of support to the staff and the infrastructures, but based on the idea of cost sharing or cost recovery, so that the patients would be paying a certain amount for the medication and a certain amount as well for the consultation, medical consultation, meaning that when you have a large number of displaced people coming in, people may no longer be able to pay. And so these organizations have been really faced with the challenge of trying to cope with people who are in a very precarious situation and can't pay anymore. There are quite some significant needs in terms of violence, so our projects treat violence on an everyday basis. In Niangara, for example, we treat sexual violence victims. There we've treated in 1.5 months quite a large number, 35 for us. This is a large number because it's the beginning of a project, so it means there's a certain level of confidence, and it's quite a strikingly high number, also for an area which has not been very much exposed to information about the topic. However, the normal morbidities or problems that we treat of people are actually rather typical diseases for the region on the one hand, so malaria, respiratory infections, and sexually transmitted diseases, so the normal diseases that continue, but also a number of diseases that are related to stress, and these are gastritis and generalized body pain, which are indicators on the one hand for a difficult living situation, so not enough to eat, so very hard working conditions, but they're also definitely classic indicators for